Hi, everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director of Clinical Education and Partnerships at SICA, where we partner with healthcare providers to offer medical body composition solutions. Today, I'm super excited to be joined by Dr. Mike Albert. He's an obesity medicine physician and entrepreneur. He runs the telehealth operations and an obesity medicine practice called Accomplish Health. And he is all over the internet. I have not made it to TikTok yet, but I understand you're highly effective there. But I appreciate and respect all of your, professional conversations, especially in the LinkedIn and in the Twitter or X space. So I'm really excited to have you here with me today.
Absolutely. Thanks for having me. And I have a lot to say, so we'll see if that comes through here.
Well, good. And I'm here for it. And I could talk for hours, but I know our listeners may drop off after a little while. But I first wanted to have you on because I know that you're doing a talk at our upcoming Obesity Week meeting. And you're talking about the practical applications of obesity medicine and obesity management in telehealth and billing and prior authorizations. And I think that is such an important topic as we're talking about medications. So I thought maybe you could tell us a little bit of a sneak preview on what you're talking about there, and that might get us talking about some other things that are appropriate here.
Yeah, I mean, I think that the reality is physicians, a lot of clinical providers, we get very little exposure to the business side of medicine. And I think if you're going to run a successful private practice, if you're going to even be part of a large group and be part of the leadership that helps to change and evolve the business, then you really do have to understand even the boring parts of providing healthcare. And so, we're going to talk about how telehealth has started to reshape healthcare as we know it. A lot of that born in the post-pandemic era. We're going to talk about what are the nuts and bolts of billing, things that people may be aware of, not so aware of in terms of services that they can provide and receive payment for. And then we're going to talk about kind of what the future looks like in terms of leveraging technology to deliver care in different ways, using things like AI to enable different forms of care or different types of administrative efficiencies, and ultimately, bring it back to the part that everyone loves the most, prior authorizations, and how you can sort of think about that and construct an entire system for managing that. Because increasingly, the burden for healthcare administration is being placed on the physician and the providers and their practice. And that's not also something that we have a lot of education and training to manage. And so a lot of people have learned through trial by fire. And hopefully I can provide some insights through my own fires that I have been ventured through, and how you can navigate that pathway and hopefully better serve your patient. So it's going to be incredibly practical. It's going to be at times a little bit boring because you have to learn the boring stuff to be able to run a business. But hopefully really valuable to people at the end of the day, and they can take some of those lessons and take it back to their practice and make it better, so that they can continue to expand and do things that allow them to have a viable business and a practice that can serve people for many years to come.
Wow. Well, I definitely think that is going to be well attended. I think with prior authorizations, I am a former bariatric program coordinator, and so I would have loved to hear more about that back in the day. I think that was a huge burnout part of my job, was really trying to figure that out, and every insurance had wildly different criteria for what constituted, medical necessity for bariatric surgery, and so I did my best pre AI to have a really good system of, managing these kind of the criteria that they had. But it was tough, and it was hard to get staff to care as much about my detailed algorithm of how to manage it as I did. So I think not only in the medical space, but the surgery space, I think that's really important. And I think we're also seeing a lot more kind of convergence of the two, right? I mean, I left my bariatric program right before all the medication became a lot more popular, and so it's been a really wild and interesting time. Um, but now there's so many programs that we're not looking at these things as separate and distinct
Right.
categories. Like, are you surgical or are you medical? It's sort of all together. I think you're seeing that a lot more in your practice, right?
Yeah, I mean, I think always like to use this sort of oncology analogy because I think it really sort of lays the ground for what I think the future of obesity care will often look like. And I've shared with people, obesity unfortunately still operates in a silo that exists outside of healthcare for the most part, right? There are aspects of obesity treatment that have been integrated into sort of the landscape, but for much of it, whether it's payment, reimbursement, clinical team development, administration, a lot of that still exists outside and is still pretty siloed. And so, I think as we look to the future to provide more comprehensive, more longitudinal care, increasingly it's going to be bringing that into the healthcare fold so that obesity is treated like any other chronic disease that requires a sort of comprehensive and holistic approach. And I think to do that, we're going to have to look at other models that have been successful in bringing together these sort of multidisciplinary and integrated teams. And I love oncology in that regard because they've created like these institutes, right, where you have the surgical oncologist, the radiation oncologist, the medical oncologist, the nutritionist, the psychologist, all the administrative support under one roof oftentimes. And they're all sort of working together, leveraging each other's skill sets to help the individual wherever they are in their cancer journey, right? And so I think obesity is going to move in that direction where you have these multidisciplinary integrated teams where the surgeons and the obesity medicine physicians and the nurse practitioners, PAs, nurses, everyone is working together sort of under one roof and providing, as I always say, the right care for the right person at the right time, right? That's the sort of goal of precision medicine. And so that is the future. I think there are a lot of people that are still operating based on relatively outdated mindsets that you can only do one thing or the other, and this is the only way to approach obesity. I think ultimately we want to use all the tools at our disposal. We want them to be sort of seamlessly integrated in meeting the patient in the moment of need, right? And so I think increasingly, as I think about my individual practice, it's around how can we help to shape the change that we want to see. And so a lot of the work we do, whether it's a business development standpoint, it's sort of bringing together all these stakeholders. And we've built a very unique infrastructure that allows us to provide really comprehensive obesity medical services, medical bariatrics, medical nutrition, even psychology and mental health services. And we're looking to work with partners who want to build these type of integrated programs, wherein they don't have some of those things, and we can work seamlessly because increasingly technology allows us to bring things together in really unique ways, but in real time, which I think is a lot of the promise of technology if used correctly. And so, yeah, I think it's once again trying to shape and drive the future that I think a lot of our patients and people living with obesity deserve.
I love that. And I especially love bringing all of those comprehensive, all of the interdisciplinary folks together in a comprehensive approach, because that's kind of been the model in bariatric surgery when it was just sort of, surgery in its own program. But that, of course, was not the right procedure for the masses, right? But now we have so many people who need this care. I think it's really important that we get that approach everywhere. And I know, there's so many different business models and folks who are coming onto the scene new and trying to do this and trying to get in on, something that's a buzzy trend, which of course I have thoughts on that. But for the folks who are doing it right, I think we really are taking these sort of lessons learned from the care of people with severe obesity from surgical programs and sort of integrating that with the medical approach, and not forgetting, like you said, the dietitians, the nutrition, the exercise, and the behavior and psychology. I see a lot of programs that are popping up missing that, where they're just worried about getting the medications in the hands of patients. And then I also see folks who are really almost like anti-medication, anti-treatment of obesity, because there's people who are just taking the medication. So it's sort of on both ends of the spectrum. And I think we kind of settle in the middle of taking care of the person. These person-centered approaches are really the ones that are going to last, don't you think?
Yeah, and I think to your point, the sort of recent moment that obesity has had, I think has fostered a lot of really important discussions. But as with all things, you're going to get a lot of variation in how people approach it just because there's so much attention, and that's going to attract all sorts of different people into the space, some of which are maybe, less promising actors, to be diplomatic. And so I think we're seeing all types and varieties in the way that people are approaching it. I think maybe how we're different at Accomplished Health is that we're really looking for the long term, understanding that obesity is a chronic disease, right? It's a chronic relapsing progressive disorder that, if otherwise is not effectively managed, has a tendency to get worse, and has a tendency to have higher rates of complication related to downstream poor mismanagement. And so for us, it's around building these sort of comprehensive but also sustainable and holistic long-term models of care. And that's just respecting the disease and what it is and what we know it to be, and then helping people navigate that over, really their lifetime. And so this sort of flash in the pan, business exploitation, which I could really rant about, but
Yeah.
I don't know that anybody wants to listen to me rant about that. I think it's highly problematic because it treats obesity as this sort of opportunistic weight loss commerce, and really we need to think about it on a longer term scale. And to do that, we have to be very thoughtful with our approach, because people are going to have different needs at different times, and not everyone's the same. It's not a GLP-1 for all strategy, right? It is, some people, they're going to have other medical problems dominate this sort of obesity. Obesity is a complication of that. They're going to have obesity leading to other issues. They're going to have medication challenges. They're going to have hormonal or psychological issues or socioeconomic. And that's not solved by a single drug. Right? The reality is you just can't. And so we need to have this, integrated biopsychosocial model of care that really, I think, respects and provides the level of care that, once again, obesity deserves, like many other diseases have long been provided and afforded. And so that's sort of, once again, the future that we're trying to build, particularly in my practice.
It's so important that we do it that way, and you are very diplomatic in that. And I love also just that, focus on the person, where we don't want this to be another era of more diets that don't work for long term, more medications that come and go. And what's left is the people who have the disease that is chronic and relapsing and progressive, that they end up being left off worse than they started without any options. I think that would be one of my bigger fears for what's happening right now. And so I do hope that people who are getting into the space are doing it, you said, respectfully, and putting that person at the center. And so I think it's also a different age of putting people, like the patient has to really advocate for their whole healthcare team a little bit more. They may be getting a primary care here, a dietitian there, an exercise, professional somewhere else. And we're putting a lot on the patient to have to navigate and figure out. I mean, I have a hard time figuring out which of these companies are legit, and how are they practicing, and are they making sure, that a dietitian's getting connected, that they have resources. And so, and imagine that for people who are not expert in this space, it's very confusing. And you hear a lot of other people talking about medication, and I want to have that, I want to lose weight. I want to change my, lifestyle. And so it's easy to become prey even to some of the more predatory, I guess, things that are out there too.
Yeah, I think, I don't blame anyone for struggling to navigate this. Healthcare by itself, obesity aside, it's really difficult to navigate, even for people like myself who, this is all I do. And I'm deeply involved on the business side of healthcare as well. And so I don't fault anyone for struggling. I think we have to continue, advocating for our patients. I'm a firm believer. It's the whole reason why I sort of really invested more time on social media in the last 5 or so years, because I realized increasingly this is how people are getting their information, right? Whether I like it or not, you might not care for social media at all or the internet at all. But the reality is a lot of people are living online, right? As we are increasingly connected in this sort of digital world. And so, if we're going to help provide the right type of guidance, the right level of support, the right amount of education, that we're going to have to meet people where they are. And so that's, once again, it's not the sole reason, but it's part of why I have invested so much time on social media to educate and to advocate, is because I understand this is where our patients are, and to help them navigate the process, at least to the best of my ability, because I agree it's incredibly difficult, and there are so many people that, once again, are offering all sorts of solutions, some of which I think are more on the exploitative side, that if I can do anything to help guide people, help them find better resources, as I often say, even if it's not working with us, but working with someone reliable, then I've done something well.
Yeah. So I haven't been on TikTok. I'm hesitant to that, but I remember back in 2007 or 8 with my bariatric program, it was like, should we get a Facebook page or not? We don't really want to address medical questions in this space. And I remember that was it was a tough place because you want to be there and meet them where they are, but you also don't necessarily have the time and resources to dedicate to the purely medical questions. So how do you navigate that? I mean, what kind of stuff are you I'm sure people are interacting with your content and asking medical questions. What's sort of the themes, or what are you seeing from that side of your world?
Yeah, I mean, it's challenging, right? So, I obviously tried to remain as professional as I possibly can, which sometimes is problematic because internet culture can be incredibly toxic. Just go to every third or fourth comment, right, on a page, and you'll often be surprised at what someone is willing to say. So I think, one, it's trying to provide content that's very educational. Leading with that first. Born out of the work on TikTok and sort of communicating with other content providers and content creators in the healthcare space, we often talk about the type of content we create, particularly on TikTok, as being edutainment, whereas this hybrid of education and entertainment, because at the end of the day, the algorithms are promoting and pushing content that increases engagement on the platform, right? And so inherently they are favoring content that is more attractive, that is more engaging, that is keeping people on the particular post, or engaging with the particular application. And so it lends itself to being creative and trying to find ways of designing the education in a more engaging way, in a more appealing way, because often a lot of what we talk about in science isn't very sexy. It can often feel very on the nose and kind of plain sounding, and that ultimately is not going to get well communicated. So it is a little bit of an art, and it's a skill, but you can learn it through practice and being a student yourself. But it's really around designing educational content in a way that is engaging ultimately, and then navigating on the back end. The comments and appeals that I get is a challenge, but I've had some practice over the last few years that I really try to stick to things that are really more high level education and advocacy, and in terms of the individual medical questions, I always try to refer people back to their local providers or whoever's part of their care team.
It's definitely hard. You seem to do it with ease, so it's good to know that sometimes that's a struggle, I guess.
That's definitely a struggle. Whatever this looks like, no, there's a lot happening under the surface at times.
And but it's so important. I think for so long people were not wanting to get out there and interact directly with patients like that. And then who fills the gap, because that is what people want to talk about, is people who do not have the training, and that's a tough one to manage. I mean, for me as a dietitian, there's a lot of people with lots of nutrition information to give, and no credentials to back that up, but patients and people interacting with that content don't know. They like the look of someone, or they like what their outcomes are, and so they're willing to follow whatever that person's recommending. It's so tough to bring them back, like you said, to the science and the unsexy stuff, and away from these temporary challenges and trends and things that they want to do just to get more get more likes and get more immediate sort of gratification.
I mean, I often talk about sort of the dualities here, right? So, even if you don't want to be on social media, your patients will be on social media, right? And the void created by your absence will be filled by something. That is a fact. People need to reconcile with that. And so even if they don't feel comfortable or don't know exactly how, often just starting is where you can begin. Because once again, if you're not there to help shepherd people, to give them the right kind of education and learnings, someone else will. And often whoever fills the void is, often going to be problematic or may not be their expertise, but they are providing it their sort of non-expertise either way. And I talk about this with obesity treatment too, right? It's like, okay, you don't have to pursue treatment either, but not pursuing treatment is also a choice and also has consequences, right? Like people often look at it as like only surgery, choosing to have surgery is risky. Well, it's also choosing not to have surgery has a risk, right? And so we have to look at the sort of dualities and both sides of it, and that everything's a choice, everything has consequences. Our lack of action or inaction also will result in some type of outcome, and we often forget that. We often operate from the base case that that isn't a reality, and inaction has its own consequences.
Yeah, that's a solid point. Well, I wanted to get into a little bit before we go, to talk with you a little bit about body composition. I know I've seen your public, thoughts about that. We haven't chatted about this directly, but I know in a lot of these virtual care practices, that's kind of a challenge of how do
Yeah.
we measure and get, people's body composition data when we're not seeing them in person. So even, thinking at it from what are patients talking about? What's their understanding? Is there a big gap that I could help fill? I think we need to be thinking about what people are asking. I also know with a lot of the clinical trials, we're having at first a lot of just weight data, but hopefully soon we'll have a lot more other outcomes like changes in muscle mass and adiposity. Hopefully to see how the medications are changing their body composition. But I'd love to pick your brain for a minute about that.
Yeah, I mean, I think I think it's super important. Body composition data and like why do we care? This is the part that I lose sleep over as I think about the clinical programming that we provide our patients. Uh, One, it's sort of helping us to better understand disease, better understand health status, right? So, in speaking about body composition, like knowing the composition of tissues, their distribution, it tells us a lot about the state of health of an individual, and far more, it gets far more specific than anything like BMI could ever provide. And so there are real advantages. And when we think about the types of data and elements that we are wanting to capture and monitor, it becomes really important because this ultimately helps to describe the sort of efficacy of the approach. It helps to describe the quality of the approach, like how safe it is and how a patient's doing throughout that process. And so you're right that if you are exclusively telehealth, you have some unique challenges because that technology may not be as readily available to your patients. And so this is the part that I think a lot about. I think there is opportunity when we think about how technology can integrate into a lot of these digital systems, to leverage some of these remotely delivered technologies. So we use connected scales, for example, that feeds our system data. So we get that objective data. We're not wholly relying on self-reported weights, which for one reason or another can be highly problematic.
Mhm.
So, that's an aspect. Increasingly, we've adopted an approach in our clinic as patients are starting to lean out. If there ever is any question on whether it's appropriate, because I will be honest, and some of this I think is legacy sort of mentality, but we get a lot of patients, even as they get very lean, that often ask, they still want to lose weight and they still want to increase their intensity of treatment. And we have to ask ourselves and reconcile with the fact is that appropriate
Mhm.
medically from a health standpoint? And so increasingly we are using body composition measures to help guide us because we don't want to lose weight just for the sake of losing weight. Like there's certainly people can pursue vanity, exploits in their own time, but the treatment we're trying to provide is healthcare. We're trying to provide real medical care that is having a net benefit on an individual's health, right? And so we increasingly use body composition not as a way to sort of track longitudinal change, because that's challenging for us to scale, particularly across the various states that we serve and various populations, but on case by case basis where there's question as to whether disease has been effectively managed. Is it appropriate for someone to lose? What is the current state of their health? So we are looking at, do they still have excess adiposity, right? Is their body fat percentage still significant? Just had a patient in the past week, we got a body composition scan on, and despite the fact that her BMI was 26, which a lot of people would say, oh, that's great. She came from a BMI of 35. It's now 26. She's doing great. She still had 42% body fat. So, depending upon which structure you go, 42% is still classified as having obesity from a body standpoint for a woman, because it's associated with more health complications. That's where the sort of body fat thresholds were developed. And so for her, we were like, yeah, actually, you probably would benefit from losing a little more fat in particular. And we look at things like, trying to understand bone mass and make sure that women, particularly who are at risk, either because they're peri or postmenopausal, as they're losing weight, we're not compromising bone health in the process, right? So someone with a BMI 26, if we're starting to see that their Z-score is, getting close to 2 or is even beyond 2, that would suggest that they have degradation of the quality of their bone and bone mineral demineralization, that maybe that is problematic. Maybe that's not the right option for them. Maybe it's actually healthier on net for them to maintain their weight or even gain a little bit of weight back. And so I think these are all the complexities and difficult questions that we're trying to answer in a virtual care setting, which has, once again, unique challenges. But I think for sure, even though we're providing remotely delivered care, we are still looking at body composition as a meaningful measure to, once again, getting back to understanding the efficacy of our treatment and sort of the level of safety and health that individual is going through. So yeah, I think body composition is super important, and I look forward to a future where we have the types of technology that make it commercially available to all. So it's incredibly accessible. So we don't have to rely on these imperfect measures of, BMI, or even everyone's new, I got to read up more on this body roundness
I
index that
know.
everyone keeps sending me. But all of these, they're all just proxy measures of health and proxy measures of disease. And so they're going to be imprecise on some level because of that. And as we can measure more directly the amounts of body fat, how it's distributed, how it's functioning, then we're going to get closer to the truth. And I think ultimately that's what we're trying to do in providing really good care, is really understand and get as close to the truth as possible.
Well said. And I think too, the idea that it has to all be in one program and under one roof, that may be our kind of older school mentality. And some unique ways that I'm seeing people kind of make that connection, maybe, partnerships in the community, or finding places where people can go on that one-on-one basis, where a patient lives here and this is their, access to a body composition device or facility that does that. And so, yeah, I think, initially everybody says they want a home scale that can measure this at home accurately, as good as the clinical grade devices that we have. And that could be a whole nother talk. But from a behavioral standpoint, I don't know that I want everybody having that data on their own at home to let that sink in every day when their body composition is not changing every day. So I do think that there's some reason to have that a little bit separate than like the scale, which trending daily does have more benefit. And so I look forward also to whatever the next model is going to be, where we can use the right kind of data for the right patient at the right time, and what that looks like.
Yeah, I mean, I think that's right. So we want our data to function a few ways. We want to be able to gather it relatively easy, but then make meaningful use out of it, right? And so just gathering data for the sake of gathering data isn't always helpful. and in some ways can be harmful. I talk about this a lot with the big push towards monitoring glucose in any and all populations. Just because you can monitor your glucose, because you can measure it, doesn't necessarily mean it's going to be meaningful for you, doesn't necessarily mean it's going to help and benefit you. And in fact, in many cases, I sort of coined the term glucorexia nervosa to describe the state of we're
Mm.
having people obsess to the point of it causing them distress what their blood sugar levels are. And in most cases, we have not been able to prove that measuring blood sugars outside of particular disease states is meaningful. And we have a lot of companies promoting measuring blood sugars in every situation. And so, getting back to your point of having too much data can also be problematic because we're not making meaningful use of it, is I think something that we also have to come to grips with. And I think, we need to be able to gather data. It needs to be accessible, those ways of gathering data, but it also needs to be done in the right way. Because ultimately, if you're not able to purpose that data in the right way, it absolutely can lead to issues, and not the least of which is causing harm in that individual. And so, we have to understand all the dimensions of this thing and make sure that once again we're going about it the right way, and we're not just commercializing the access and the capturing of data for the sake of a good business venture, that it's got some thoughtfulness behind it.
The continuing glucose monitor idea is an interesting one too, because it's I do think sometimes we forget that just having information or data does not equal action or does not equal behavior change. And I'm reminded of that constantly when you talk to a patient about how are you able to actually like take this data and information and have that enable your behavior change. And it's not just knowing this is what my 20 points of data are. Just knowing it doesn't work, and it's like we forget that in the moment. Like just knowing what your blood glucose is does not make you eat something differently permanently for the rest of your life, right? It has this sort of allure of like, okay, I have access to this data, like you said, just that meaningful use. I think that's a good term for it, for sure.
Yeah, we want to have data intelligence, and ultimately it needs to be able to serve the individual in the right way. So just gathering data, it is wrote with problems if we don't have a thoughtfulness behind what we're going to do with that data. And so once again, meaningful use, making sure that the devices are being utilized when they need to be, and then also on the other end of it is making those highly effective devices accessible, right? So we're talking about inappropriate or excess use, but also underuse is a problem too. So like I want to say that there are two sides of it. If we don't have effective devices accessible to the people that need it, that's also highly problematic. So there's two sides of it that we have to appreciate, and this is where the people that are shaping policy, the people that are paying for population health management, need to be educated about these things. Is like there's real utility to things like body composition if utilized the right way, and it can help to shape and improve the type of care we're providing. But once again, that's only possible if it's accessible. That's only possible if we educate people on how to use it and then get it in the hands of the right people that need it.
Wow. Well, that's very well said. And I think that's a good ending place for us. I really appreciate sort of your practical application of some of the complex, the business and the science. I think that's really a unique place where you sit. And I'm happy to be along to stay educated from you. And I appreciate your time today.
Yeah, thank you, Nina, for having me.
Thank you so much.